Hello there. My name is Berna, also known as Bad Berna. My pronouns are she, her, and I'm a fourth year at Cal. This is my second year in SHEP, and I'm currently a decal co-facilitator. Super fun stuff. Without further ado, let's just get into it. So today's topic, we'll be exploring lesser common or less talked about STIs. So I feel like, especially on a college campus, whenever STIs are brought up in the conversation, or if you're given like a pamphlet at the doctor's office or something like that, you always read the same sort of five: it's gonorrhea, chlamydia, herpes, HPV, and HIV. And while these are the ones that are far more prevalent, it's not like an exhaustive list by any means. So I think it's good to sort of be informed on the other STIs, even if they're not as common. Just kind of keep it in mind at the very least. So yeah, let's just get into it. So first up, we'll be talking about an STI called lymphogranuloma venereum, kind of a mouthful. So this STI, we'll call it LGV for short, is a bacterial STI that is actually caused by sort of the same kind of bacteria as chlamydia, except it's just like a far more aggressive strain. So it's pretty interesting. It's spread through unprotected sex, unprotected anal, oral, or vaginal sexual contact, especially if there's trauma to the skin or the mucous membrane. So, for example, if there's like a cut, some sort of open wound, or something like that, it can also be shared or spread via the sharing of sex toys. So that's why it's very important to clean them in between uses and partners and whatnot. Symptoms include anal discomfort, pain, or bleeding, as well as feeling like you need to empty your bowels, even if you don't need to. My cat, she's super jazzed about STIs, can't keep still. Now, LGV infection for people who have anal sex, the infection is generally in the anus. So there can be like scarring in the anus if it's not treated promptly, causing like narrowing of the rectal passageway, or abnormal openings within the anus that can cause a lot of problems. If the infection occurs elsewhere in the body, usually like the penis, the rectum, the mouth, vagina, cervix, anywhere else that would have contact with like an infected site, usually it manifests as like a small painless lump or a sore at the site of infection. So the general course of treatment, because this is a bacterial STI, is antibiotics. And in terms of prevention, practicing safer sex, so using a condom and or dental dams, can greatly reduce the chance of infection. So for resources that I used and sources that I used the official government health website of New South Wales and, of course, the CDC. Part 2 of this video, I'll talk about a few more lesser talked about STIs.